Dana, and I am the nurse educator at El Paso Emergency Room. Today I'm going to be going over 3 ways to use a 3-way stopcock. Now there's many ways to use a 3-way stopcock, but I'm going to go over 3 of the most important ones we need as nurses. You can find these stopcocks in 2 places. One is in the code room, in the gray crash cart, second drawer where all of the syringes and needles are. The second place is in the pharmacy room where we carry or place all of our flushes and IV tubing inside that room. Now there's 3 components to a 3-way stopcock. The most important thing to know is that this blue indicator is telling us where we are closing off the direction of fluids to. So the first way is to help you remove specific small amounts of medication out of pre-filled syringes, such as with pediatric doses. In this example, we have an order to administer 17 milliliters of a D50 amp to a 2-year-old. I'm going to attach the D50 amp to one of the ports. Next, I grab the syringe with the volume that is appropriate for what I need, in this case, a 20 ml syringe. I attach it to the other port. Make sure that your valve is closed off to the area that you don't want to use, which is that side. I only want this one open and this one open. Now you're going to be pushing the amp to give you the amount that you need. 17 mLs right there. Take it out and administer it to your patient. Now the second way you can use this is for any instances where you need to do a rapid medication administration followed by a rapid fluid bolus, such as adenosine. So in this case, my physician has ordered adenosine 0.7 mLs to be administered to this 1-year-old. I'm going to be attaching the medication to one of the ports. Right now, I have it closed off to my patient's bloodstream. I have my medication attached. Next, I'm going to attach my fluid bolus. In this case, I have a 20 ml bolus. When I'm ready, I will be opening the port to the patient by moving this to close off to the fluids. I will be pushing the adenosine, switching the port to close off to the adenosine, and pushing my bolus at this time to the patient. And the third way is to help you with the pull and push method. You can use this method anytime you have to give a rapid fluid bolus, such as with pediatric resuscitation. You're going to be grabbing your 3-way stopcock, attaching it to your patient's pigtail. This is my venous system for the patient. I have the port currently closed off to them. Grab a 50 ml syringe, attach it to the other port, and grab whatever fluid has been prescribed for your patient. In this case, I have a 250 ml bag already primed and ready to go. I'm going to be connecting this to my last port. Now that you're all connected, you're going to come over here and open up the clamp to your bolus. Remember, you're still closed off to the patient's bloodstream. You're going to come over with your syringe and you're going to be pulling out fluid out of your bolus. Remember to keep track of how much fluid you're pulling and pushing. In this case, I'm going to go up to the 50. That way I can keep track of how many 50s I've been given. Once I drop the fluid, I'm going to move my port and close it off to the bolus because I don't want that fluid to go back to the bolus. And now I'm open to the syringe and to the patient. Now, slowly and controlled manner, push your fluids into the patient. Depending on the gauge that you have for your IV site, that's going to determine how fast or slow you do give your bolus. Once you give your entire bolus, you just do this all over again, starting off by closing your port off to your patient again. So now we're open and open. Pull out another bolus here and close off to the bolus and give it to the patient. Now you can use a pressure bag or an IV pump to administer this fluid, but this method's gonna allow you to have a more manual control, especially when using those 24 gauge catheters on pediatric patients.
So now you have learned 3 ways you can use a 3-way stopcock. Make sure that before using, you prime the 3 ports of the stopcock to avoid any unnecessary air bubbles. Next, head on over to the Education Skills Corner in the IV and Fluid Room to practice this skill as many times as you need. Thank you.